goes on, but that's the gist. I'm sure this article was along these lines from, I think it might even be from the same think tank, IFC. Appeared in the news a couple of months ago. I think I remember doing this story. So they're saying it's going to cost to rise and face billions in extra cost by 2029, an extra 3 billion a year. But what? Again, obviously cost, I understand, but my thing is, to say despite billions being put into the system, or put in the system to do what? As I said previously, to do what? Self-fit for purpose. It's a system that parents are crying out saying they can't get EHCPs for their child, and when they are implemented, it feels like their support isn't being implemented to the best of their abilities. I mean, the rise in EHCPs maybe previously could be because there's an increase in, particularly in neurodiversity being, seems to be a peak in diagnosis across the board. Adults and children, particularly in the last 5 years, we've seen massive increase in ADHD diagnosis and autism diagnosis. So we could just be that more of these conditions being picked up, or it could be other factors, socioeconomic factors, like I said before about the rising costs in terms of benefits to young people. You look at what they've been through in the last 5 years in terms of the pandemic and the effect that the pandemic had on them in terms of education, isolation, and so forth, and trying to readjust a world that already didn't have much for them. And when you look at those same socioeconomic barriers that face people today, you add that to maybe health needs that haven't been picked up on before. But I can easily understand that some of it could just be that these joints need to be diagnosed more effectively than they were previously. But also there's a problem with the system because it can keep throwing money at the problem. But if the processes and protocols aren't working for the individuals and their mental health, because it's meant to be a person-centered plan, and you've got class sizes, particularly in mainstream schools, etc., and so forth. There's talk of, I think last article, there was talk of the need for more special schools, etc., and so forth. Now, I'm not saying special schools don't have their place, and I think there's of pupils that probably do need them function in mainstream schools, even in paper referral units, which even now even the name seems isolationist, etc., and so forth. However, I wouldn't want to go completely back to it. The system now. I was educated in back in the late 80s, early to mid 90s, late 90s. Special school system, which seems so far isolated in terms of the outcomes to mainstream schools. But they do have their place. But whatever system you put in place, and whatever strategies you put in place, they've got to work. It seems to me that it's not just a case of finding more money, it's a case of what is wrong with the strategy, what is wrong with the actual system is broken. Whether it's trying to access it, or whether it's actually do these plans actually work, do the professionals are actually implementing these plans, have the skills and the ability and the support systems to actually implement them with individuals, one-to-one pupils. And it seems as though in a lot of cases that might not be the case. So again, I go back to what I said previously about, received the love and good money after bad, about reform, etc., and so forth, about drilling down into political policy and the actual processes of how you actually realise this policy in real life in terms of systems and etc., and so forth, and do they actually work? But it seems like just seem to reform, not just in education, but all over the political landscape, whether Department be, whether housing, etc. and so forth. It's for the same policies recycled and the same problems that seem to exist without any real significant change to the nuts and bolts of how they deliver it. And yes, money is important. Money makes the world go round, but it won't mull into a system to deliver the same outcomes because the processes are wrong. He's not going to solve anything. So I think, again, new ideas and a wholesale review of what the outcomes are, what you want to achieve and how you're going to achieve them. And a whole redesign of that system. And I think, much like with disabled adults, disabled young people who can contribute, those who do have the ability to have a voice in terms of how that system works for them. Obviously, parents need a voice as well. I think disabled pupils and school leavers, those have maybe been out of the system for 5 years or whatever, or maybe in higher education, whatever, perhaps need to have input into that as well, and adults. And experiences need to be sought and, really engaged with in terms of how to shape the future of SEND's system as well, because ultimately everyone's on the receiving end of this education. Obviously, these experts, they're not going to be experts in terms of the delivery of education, but in terms of how it falls in the outcomes, have a point multiplier. And that's true of the welfare system as well. I think, in true engagement, however that looks, obviously it's not an easy thing to do, but, something desperately wrong with the system and won't just be fixed by more money or cuts, in my opinion.